Again, how would you deal with chronic hives? I use all kinds of things. The question is, why would your body overreact, particularly if it's something like pollen or something like that? The problem is always not the reaction. The hives are just the body's attempt to eliminate something, to detoxify. The problem is that your barriers were too weak. And so you're allowing the world to get into you more than it should, particularly not very toxic stuff like tree pollen and cat hair. And there's nothing about that, or cat saliva, that should make anybody sick. And if you're overreacting to that, it's because you're leaking. And that could be the cause of that. Again, could be a lot of things. Glyphosate is certainly a huge contributor because it seems like it pokes holes in your gut lining. But it can also be emotional, can also be not enough sunlight, and all the usual things that we talk about. Remember also that this all-important barrier in your gut is really a watery, organized, coherent gel that lines your gut wall. And so if you have essentially a shrinkage of the gel layer, it contracts because you're either dehydrated or you're not making good enough gels. Then you'll get cracks and holes in the gels, and then you'll start absorbing things which you have no business absorbing. And then you'll make hives or some other skin inflammation or cough or mucus to get rid of it. That's the therapy part. And the solution is not to avoid those things necessarily. You may have to do that temporarily in bad cases, but to work on improving your gel layers and whatever is interfering with the formation of healthy gels. So you said, here's another one. Somebody has osteoarthritis in their knees or fingers, and why would your body do that? One of the ways you can tell why the body's doing it, partly I spent a lot of time asking people what happened, and you could often see how this process developed. So that's one way. Another way is to find out what works to actually heal the problem. And so one of the most famous folk medicines for treating this, what we call osteoarthritis, is bee venom therapy. In other words, you sting somebody with a bee. Now, I'm not necessarily saying you should do that, although I've seen a lot of people with arthritis get dramatic relief, maybe even cured, by stinging themselves with bees. But the real question is, why does that work? So what that leads you to, what is the problem with osteoarthritis? The problem is you're building up debris, in particular calcification in the joint. So you get little spiky calcium deposits that build up in the what should be the healthy gel layer called the synovium and the bursa. Instead, they become filled with calcium. So the question is, why did that happen? Well, it could be that you took too much calcium as a supplement. It could be that you took vitamin D3 as a synthetic hormone, which essentially forces your body to absorb more calcium than it wants to. So it has to put it somewhere because it doesn't want to put it in your blood vessels. So it puts it in a harmless sort of place like your finger or your knee. Now that you've got a calcium deposit in your knee or finger or toe, your body has to try to get rid of it. So it makes an inflammatory response to try to dissolve it. But if you go along and take something like ibuprofen or aspirin or prednisone or, chloroquine or something like that, you will inhibit the inflammatory response. And all of those drugs have been shown to increase the progression of osteoarthritis. I don't have the study off the top of my head, but I looked into that years ago, and I found that people who use like Advil or Aleve have a more rapid progression of their osteoarthritis. Why? Because the inflammation is the therapy, not the disease. The buildup of deposits, in this case, usually calcium, that's the disease. And if you stop the inflammation, you will have a greater buildup. So what does bee venom do? Well, it makes a more intense and dramatic inflammation that dissolves the calcium deposits and lets the knee go back to normal. So you can do that with bee venom. You could do it with turpentine. You could do it with maybe fasting. You could do it with exercise, which brings more blood flow to the area. There's lots of ways to do it. The important thing is, if you think like this in every situation, it will lead you to the therapy, because it's very simple. The symptoms, these so-called diseases, are your body's therapeutic attempts. All you have to do is ask the question, why would it do that? There's usually a fairly obvious answer. And then you try to work with your body doing that, and that will lead to